Hi everyone, my name is Hsiu Zhuang. I'm here to talk about quality management and then the use of a PDSA, that is plan, do, study, and act, to improve quality of healthcare. Through this presentation, you will learn the first steps of PDSA and see how it can contribute to quality management. I will explain the first steps of PDSA and describe how PDSA can be used in pain reassessment. Quality management is the way to monitor and oversee procedures or activities in order to keep a desired level of quality care. PDSA stands for plan, do, study, and act, and is a scientific method to work towards an effective change in the work environment. A recent study shows that inadequate management of pain is the major problem in healthcare, and almost 40% of time, pain was not reassessed after an intervention. In the PDSA, P is plan and start with assess the problem, identify it, design a plan, and create a measurable outcome. D is do. It requires collecting data, observing the process, and documenting it. S is study. This step is to compare data, analyze, explain, and summarize it. A is act. During these steps, it focuses on evaluating the situation, making a conclusion, finding a solution, or what should be improved, and what the next step is. Step 1, plan. When I audited pain reassessments, I found only 50% of nurses did pain reassessments. So I interviewed nurses as to why they forgot to try the pain reassessments. And they stated that they constantly check on the patient who had pain medications. It's just the work of going on the electronic charting, putting out the document flow sheets, and charting the number of pain labels that makes them forget to complete the pain reassessment. So through this PDSA project, I hope at least 90% of pain reassessments will be completed. So my plan is to observe patients who have pain medications, separated them into 2 groups, and perform a 1-week trial. I will use the snooze alarm theory to remind nurse to document the pain reassessments. Step 2 is do. It focuses on observation. I observe more than 50% of pain reassessments are not documented. I've seen nurses constantly come in and out of the patient's room during the whole shift, but most nurses forgot to chart the details, such as patient's intake and outputs, activities, and pain reassessments. So I created 2 groups. Group 1 is the control group, without a snooze alarm, and group 2, which is the experimental or treatment group with the snooze alarm. I used snooze alarm function after the nurse gives pain medications to the patients. The nurse needs to reassess the patient 15 minutes after the IV injection and 1 hour after the oral medications. I have nurses set up the snooze alarm after they give pain medications to the patient. The snooze alarm starts at 5 minutes prior to due time, exactly on the due time, and every 5 minutes after the due time, until the pain reassessments documenting are completed in the electronic system. Step 3, study. I learned from this project that nurses are really too busy to chart everything they do to the patients. I compared 2 groups, control and treatment groups. The control group shows that without the snooze alarm, 40% of pain reassessments were documented in the electronic charting. In the experimental or treatment group with the snooze alarm, 100% of pain reassessments were completed and documented in the electronic charting. Step 4, act. Through this project, I concluded the nurses are too busy to finish charting when they get too busy at patient care. I used a small electronic device, had nurses carry it with them after they give the pain medications to patients. It shows that The nurses who carry the device documented pain reassessments after pain medications. My suggestion which is the next step, is to recommend our Health Connect charting system to create a snooze alarm function for the pain reassessments or any documents nurses often forget. Hopefully, it will help nurses to perform a higher quality of patient care and thus increase patient safety. Here are my references. Thank you for listening. Bye-bye.